The mental health charity SANE has been campaigning for over 20 years for improvements in inpatient psychiatric care. They receive hundreds of calls from concerned relatives.
The families that ring us, they're desperate because they can no longer make sure that the person they love is safe. They've left it up to the National Health Service or the hospital looking after that person to make sure that that person is safe. And so often we hear of people being left unobserved, people being left with ways of harming themselves, and most of all, absconding from the wards.
She could have hallucinations. The telly, the radio could be talking to her. If there was a famine in another country, she'd think that she started it.
It's actually the scandal of this century now that so many people are allowed to commit suicide who don't need to commit suicide. And just remember that actually committing suicide is just the tip of the iceberg. Just think about the kind of suffering from the people who nearly commit suicide, for the people who harm themselves in these really heartbreaking ways.
Hey! In Tolworth Hospital, our reporter found that staff were not doing enough to prevent patients from harming themselves. Staff seemed remarkably unconcerned that the patient had a razor blade.
Does anybody want it? Because I found this in her room.
They also seemed surprisingly complacent when she reported that the patient had told her she had thoughts of killing herself.
I was feeling very vulnerable and she was talking about suicide or suicidal thoughts.
I've heard it for 9 years, Joe. Anything new? Sorry, I'm not being... That sounds a bit cynical.
So we should check on her though, keep on checking on her though.
Yeah, we do check hourly, but you know, if she wants to do it, she'll do it.
I've acted as an expert in nearly 100 inpatient suicides. Many cases are eminently preventable.
There were around 180 suicides by psychiatric inpatients last year. That's 2 a week.